Okay, what I'd like to briefly discuss with you is I really wanted to give you a stronger understanding of the connection between the hypothalamus, the pituitary, adrenal axis, and then the hypothalamic pituitary thyroid axis. There's a really intimate connection here, and I just wanted to explain it to you. So if we hone in and just focus in here, on the HPA, we'll see that, okay, the hypothalamus is going to send a hormone to the pituitary, and the pituitary will send a message to the adrenal. Now, we also see here that the hypothalamus has the ability of sending a chemical message to the pituitary, and the pituitary can send a messenger to the thyroid gland. Now, keep in mind that the pituitary has an anterior and a posterior division. So here, I also want you to see there's a hypo and a hyperactive response. So on the left-hand side of each of this, it's showing a hypoactive, like a minimal reaction, but we're going to focus on the hyperreaction, okay, because I think this is quite common. So the hypothalamus will send the corticotropic releasing hormone to the pituitary. Remember, there's an anterior and a posterior pituitary. The anterior pituitary has the majority of the hormones, whereas the posterior pituitary is ADH, antidiuretic hormone, and oxytocin. So the anterior pituitary has FSH, LH, growth hormone. It has adrenocorticotropic hormone, right? It's got the majority, melanocyte stimulating hormone. It's got all the biggies, including adrenocorticotropic hormone. So by its name, adrenal gland, cortico, or cortex, adrenocorticotropic hormone. Now the adrenal gland has a cortex and medulla. The cortex is the outer perimeter. The medulla is the inside. Remember, the medulla gets connections from the neural system directly. Okay, so from the neural system directly into the medulla, and the body's going to push out these catecholamines. Epinephrine, norepinephrine, sometimes we call epinephrine adrenaline, and norepinephrine noradrenaline. From the cortex is going to push out the glucocorticoids, cortisol, cortisone, corticosterone. Okay, so what are the effects when you have a hyperactivation of the HPA? Some people get anxiety. Some people get agitation or irritable. They get restless sleep. It's going to increase your cholesterol, increase your triglycerides, increase your blood pressure. Depression, right? We wonder why stress can kill, especially prolonged stress. Fatigue, reduced libido, GI issues, cognitive issues, memory issues, learning issues, loss of muscle tone, especially in the lower extremities. You start to get like smaller, cortisol will start to break down the proteins, especially in the lower extremities. So you start to get the chicken legs, but you get the pendulous, larger belly, right? So you get protein wasting, bone loss, skin disorders, reduced immunity, reduced sex hormones, reduced reproductive function, renal issues. It's a major problem, okay? Now, that's the HPA axis, HPA, hypothalamus pituitary adrenal axis. Now, I want you to see the crosstalk between the HPA axis and the HPT axis. You can see that we have these dotted arrows that say inhibition, inhibition, inhibition. So there's crosstalk between corticotropic releasing hormone inhibiting the effects of thyroid stimulating hormone. And then we see cortisol having an inhibiting effect on thyroid stimulating hormone, as well as inhibiting the conversion of thyroxine to triiodothyronine, T4 to T3 conversion. Most of this T4 to T3 conversion does take place in the liver, and it is selenium dependent. And it uses this enzyme, 5-deiodinase enzyme, which is selenium and zinc dependent, primarily selenium. So the hypothalamus releases thyroid releasing hormone. That thyroid releasing hormone goes to the anterior pituitary. The anterior pituitary releases thyroid stimulating hormone. This is all in normal function. Thyroid stimulating hormone hits the receptor on the thyroid and says, okay, you're going to push out thyroxine or T4. Now, T4 has a few options, right? T4 can be converted into T3, the active hormone, which then has its healthy biological responses. Or when the body is under stress, whether it's psychological stress, emotional stress, chemical stress, infections, allergies, dysbiosis in the gut, T4 can also be converted to what's called reverse T3. Now, reverse T3, let's see if I can give you an analogy to this. Let's say these two pens look alike, right? So here's T3. T3 is going to hit a receptor, and when it's a perfect fit, metabolism is going to take place. All the natural functions of T3 work. Now, when your body is under stress, whether it's physical, chemical, or emotional, this T3 can be converted to reverse T3. They look identical, right? But one is opposite, so we call it reverse T3. What does reverse T3 do? Nothing other than occupy the same receptors that T3 did. So it occupies the receptor, but it's functionless, does nothing but block the receptor. So everywhere we have T3, it comes in and it can't do anything, it can't bind. Now it finds another receptor. It can't bind because you have all this excessive reverse T3. And this is why a lot of people have these subclinical hypoactive thyroids, because T3 is normal, TSH is normal, all their hormones are normal, but if they're not checking reverse T3, they could be missing what's happening. They can get these hypoactive symptoms with normal TSH, normal T4, normal T3, but they have an excessive amount of reverse T3, which outnumbers T3. So all the receptors are filled, and the normal amount of T3 can't do the job anymore. Okay, so this is why stress from the adrenals can create hypoactive thyroids. There's ways, what this shows is that there's ways of supporting nutritionally. Zinc helps to upregulate the release of TRH. We have iodine. There are some herbs like bladderwrack that help to upregulate TSH and the thyroid to support the thyroid itself. Selenium and vitamin D, extremely important to support the thyroid. To convert T4 to T3, selenium, zinc, vitamin E, super important. There's an herb called ashwagandha that's been found to be very, very useful and helpful. When we have an unhealthy response of T3, then you get these symptoms, right? Fatigue, cold intolerance, weight gain, poor memory, poor concentration, depression, irritability, muscles become weak and stiff. There's hair loss, constipation, brittle nails. So hopefully you see this beautiful, beautiful connection between the HPA axis and the HPT axis.